for accepting our invitation. Thank you, Professor. Now I invite Dr. V. Satish Kumar sir to give an introduction about our speaker, Professor Dr. Karthik sir. Over to Satish sir.
Thank you, ma'am. So it gives me immense pleasure in welcoming Dr. C. Karthik, who is performing duty as Assistant Professor in IIITDM Kancheepuram. So he completed his MS and PhD from Department of Engineering Design, IIT Madras. His research interest includes design of minimally invasive robotic surgical tools, design of surgical devices, soft robotics, application of compliant mechanism to surgical tools. So today, Dr. Karthik will deliver a talk on role of AI and ML in surgical robotics. So over to you, sir.
Thank you for the kind introduction, professors. Let me share my screen. I hope you can see my screen now.
Yes, Professor, it is visible.
Okay, ma'am. Let me start the session. So, very good evening to one and all. So, today I'll be talking some fundamental aspects of roles that AI and ML, they are taking shape in the field of surgical robotics. Robotics itself is quite a mature field today, right? So, in the phase one, we had industrial robotics. Then in the phase two, we have what is called the cooperative manipulation, where robots and humans, right, we work together. Now we are at a stage where we leverage the power of robotics in surgery, especially in minimally invasive surgery. And in the last 15 or odd years, AI and ML has got a very predominant role that's playing a very prominent role, and it is really shaping up the landscape. So I'll touch briefly on various aspects and where this field is heading, and how can we better prepare ourselves. So I'll start the talk by introducing one of the visionaries, right, in my view, Sir Arthur C. Clarke. He makes, the following remark. He says, any sufficiently advanced technology is indistinguishable from magic, right? This is true. Today, technology allows us, even though we are in different parts of the country, geographically we are separated. We are able to have a conversation through, the because of the advent of internet communication, right? In electronics, so on and so forth. So, in the course of the lecture, I'll keep coming back to this point, right? How technology has enabled us to do things, that seemingly impossible, let's say for my grandfather, for my grandmother, right? Things that they could not even imagine, it's possible today. So let me start with talking about what is called singularity, and specifically technological singularity. So human intellect here, it is represented by this orange line, right? So this is a linear curve. So slowly as we mature, as we understand nature, as we understand science, technology over a period of time, the growth of human intelligence is typically follows a linear trend, right? It is not disruptive. Over generations, we accumulate knowledge and then we slowly build on it, right? You can see it's got a very mild slope. It's quite shallow. The slope is pretty, not very pronounced. If you look at machine intelligence, right? Uh, we had the invention of transistors in the early 60s, right? By the Bell Labs. Ever since the advent of the, transistors, then we saw how it proliferated into, building complex circuitry, then miniaturization, VLSI. Today we are talking about billions of transistors packed into a very small chip. So what has that enabled machines to do is develop intelligence in an exponential scale, right? So where these two lines meet, right? Where a machine's intelligence intersects with an average human intelligence, we call that point a singularity, right? So beyond this, what will happen is anybody's guess, right? So this is what Arthur C. Clarke was mentioning, right? As technology evolves, it'll go to a level where simply it's very difficult to predict for a human being, where this is going to go, because our mind is tuned to look at linear growth, right? So our learning is, it's a linear progression. You improve 1% at a time, right? Like there is this book, right? Atomic Habits. It just says you just improve 1% a day, right? You don't look for a drastic, radical change, disruptive change. But for a machine intelligence, right? It's quite exponential. So the moment a machine can pretty much do all the problem solving, the analytical thinking, whatever a human being can do, right? That point is said to have what is called technological singularity. And beyond that, what happens, right? There are these visionaries who talk about, transhumanism, uh, exporting consciousness to a silicon-based chip, so on and so forth, right? That's right beyond the realm we can understand today. So this picture pretty much summarizes what I'm describing, right? So will we become a cyborg, right, in 50 years from now, right? I don't know, right? But that's the expectation, right? But having said that, right, there is one fundamental limitation that we have to understand. That is Moore's law, right? So Moore is one of the prime person at Intel, right? So he came up with a law, pretty much. He made an observation, right, since the advent of integrated circuitry, that computation power doubles every 18 months, right? That pretty much has been the case. But, so his prediction was computation power will double up to a point, then it will become very difficult to pack any more transistor in a given volume, right? So you can see I've taken this graph from Intel's website, right? So what they're saying is, by 2030, they are planning, they are trying to pack 1 trillion transistors, right? And they are using different techniques and technologies to realize this. So basically, this is in log scale. So even though it appears linear, right, it is in log scale, because of which we interpret it as linear. It's highly compressed. And what this picture tells us is computation is typically performed by, the more transistors you can pack, right? The more computationally intensive tasks you can do, right? But the number of transistors basically play a limit as to how intelligent a computer can be, right? Either you make your algorithm as optimal as possible to do computationally very efficient task with a given number of transistors, or given a number of transistors, that limits the number of computations you can do, which in effect limits the intelligence, right? So what I'm trying to tell you is hardware plays a limit in how intelligent a computer we can build, right? AI pretty much relies on, right, the computational power, right? So which is a hardware constraint. So today you can understand, right, all these mining operations, right, Bitcoin mining that they do, different neural networks. If you have to run any complex, for instance, molecular synthesis in drug discovery, that people they are trying to come up with new drugs for cancer treatment. These algorithms are very, very computationally intensive, and they have to be run on a big server farm, right? You have to run them on a clusters. Now, these clusters are limited by the number of transistors that they can have. So what I see is, right, it's not a software limitation, it's more of a hardware limitation, and the question of, how are we going to power these computers? So again, these are different strategies that Intel is currently taking just to bridge this gap, right? How do we put in more transistors, right? And then there are also, researchers that actually comes out of silicon, and then using what is called biological computation. Can we use, biological cells to do computation, right? That's a completely different area of research, but that is also something that the researchers are exploring, right? So before I delve into the main talk, right, I just want to highlight one important thing. So let me ask a question. So, ma'am, can the audience unmute themselves?
Yes, sir.
Okay, so just an open question to the audience. I'm just asking a question. So my question is on what is called technology saturation. Has smartphone peaked? So that's the question I'm asking. When I say peaked, I mean, is there, when you look at the last 5 years, right? Are you seeing any substantial fundamental change in the design of the smartphone in terms of the feature set? Has it improved? So there are no wrong answers.
Yes, sir.
Okay.
It's almost peaked the technology. This one's the upper limit.
Okay. So One of the participants is saying it has peaked. Why do you say it has peaked?
The applications, AI applications also, it is able to distinguish from the normal general programming things and all, kind of say language translation kind of things and all, NLP and visual searches kind of things also appeared in the system. So it's
in your
apart
view,
from speaking,
okay.
Yes, sir.
So in your view, what
Yes.
you're saying is anything that can be done has been done, right? That's what you're saying, right? Pretty much.
Yes, sir. Yes, sir.
Okay. So let me just put it in a visual form, what the participant was describing. Right. So look at the iPhone design last 5 years, from 2019 all the way to 2023, right? I mean, from a physical standpoint, pretty much, right? You can't differentiate, right? So let me give you a chronological view from a phone, right? The very first iPhone, right? Probably iPhone 3 or 4 to, let's say, S20, like 2020, right? If you see, right, it has gone through some substantial revisions beyond, let's say, iPhone 6 or 7, right? Pretty much the form factor, or what we call the paradigm. When I say paradigm, what I mean is, if you talk about a phone today, whether it's an Android phone or something which is an iPhone, right? The form factor has pretty much has been standardized, right? The size of the screen resolution, the imaging system, the overall packaging. It's become, right? There are subtle differences, but what most phones can do pretty much more or less has become the same. The reason being, right? Given this paradigm, whatever that can be done, right, in terms of hardware, we have reached a limit, right? So in from a design perspective, we say this is called as a quintessential design, right? This is like your paperclip, right? The design of a paperclip has remained the same for close to more than a century. If you go back to 1900, and if you look at a paperclip, and if I go buy a paperclip from a stationery shop today, the design practically has not changed a bit, because the optimality, whatever that you can improve, right, that has been done. So given this, right, how can we improve? Where do we go from here, right? That's the question I'm asking, right? I'll try to answer this question in the upcoming slides, right? So let's start with historically looking at another example. So I come from a design background, right? So some of you may be thinking, this is a talk on AI and ML. Why is he talking, right, about smartphone designs and silicon chips and so forth, right? I'll make things clear in the upcoming slides, right? So let's start with a basic example, right? So this I'm showing in in Europe, right? So this is during the Renaissance period, right? You can see a couple of women are there, right? They don't even have a proper lamp. They've got a candle and they are doing sewing operation, right? They are stitching dresses by hand, right? This is before the advent of the sewing machines, right? Then there is this inventor called Timonier, right? He invents a sewing machine. You can see there is a foot pedal, right? And there is a needle here, right? So you just have to press on this and the needle will basically do one stitch at a time. This is not like your modern sewing machine. This is a sewing machine where it is pretty slow, but compared to sewing by hand, right, it speeds up by several magnitudes, right, orders of magnitude. This is in 1830. Once he makes this, right, we would think, right, he would have become a very rich guy, right? But that's not the case, right? So people starts, right, he builds these machines, and unfortunately the public is not accepting of this. Why? The technology that he invents, right, to cut down on manual labor, right, it threatens the jobs of so many people. So there is a revolution, right? People don't take lightly to the idea and they attack and they burn down his factory, right? So any innovation, right, that disrupts the norm, right, is something, it strikes fear in the public's heart, right? Today, A and ML is viewed in the same manner. We are in this, going through the same phase, right? Every job today, right? Experts say every job is at risk, right? I'll back it up with data in the upcoming slides. So what are we going to do about it, right? So I'll answer some of the questions. So let us look at some of the predictions that researchers have come over the years, right? Some bold predictions, right? Marvin Minsky, a researcher in 1970. So is the prediction he gives, right? In 1970, he says, in 3 to 8 years, we will get a machine with average human intelligence. So he's talking about singularity, right? I started the talk with technological singularity. He says in 1978, right? Like his prediction was we would have achieved singularity. But we are yet to achieve singularity in 2024, 2025, right? Andrew Ng, another brilliant AIML researcher, right? He says, just as electricity transformed almost everything 100 years ago, today I actually have a hard time thinking of an industry that I don't think AI will transform in the next several years. Very true. The statement is very true. We are seeing things change right before our eyes, right? So the point is, Andrew Ng today can make this statement because he's seeing the fruits of the labor, right? That the community has been, the research community has been doing. But we can't go criticize Marvin, right, in 70s because it would have been, right? Transistor was like barely a decade old when he makes this statement. So he's just, right, doesn't have the, what do you say, the kind of evolution to just give us a very accurate prediction, right? So, but even he was convinced back, like 50 years back, right, we would have achieved singularity. So that just tells you how difficult it is to predict the future, right? It's very difficult, right? People have gotten it so many things wrong over the years. So let us quickly look at, right, traditional AI and generative AI, right? Traditional AI has been there for decades, right? This is something that's been there. Now, all the talks is about this generative AI, right? You've got your DALI, your Midjourney, right? All the algorithms that creates images like Picasso, Leonardo da Vinci, so on and so forth, right? So traditional AI, just to summarize, right? It's more like a more programmatic, right? It just follows an algorithm, right? If you want to do data organization, and it is focused on task specific, right? Traditional AI is all about, right? It needs human supervision, right? Especially in systems that have criticality, a lot of criticality, right? You need human intervention for a traditional AI, right? But for a generative AI, right? Which is what like lot is happening in the past few years, right? Like things like ChatGPT, so on and so forth, right? It is, I mean, at least the vision, right, is to perform certain autonomous tasks, right? I'll talk about in a surgical setting how these are useful, right? And to think independently of a human being, right, without any human intervention, right? That's the whole paradigm, right, of generative AI. So, what is the difference between machine learning and AI? Can I ask this question to the audience? Are they the same thing? Are they different things?
Machine learning is the subset of AI, sir.
Correct. Yes. Is there any other viewpoint? Right. So let me throw a bit more light, right? So I can ask this. So someone just said it is a subset of AI, right? Let's look at it in a diagrammatic fashion, right? Are they different things? Are they the same thing, right? So let's look at a definition of what, right, this artificial intelligence basically means. It means here, if I put it this way, right, it is greater than or equal to a human being, right? So it should be able to discover, find new information. It should be able to infer, right? And AI has to infer, means it should be able to read information and reason based on what it is reading, right? So this is basically I'm going by what IBM defines as AI, right? I'm referring to their sources. So machine learning, as one of the participants rightly pointed out, is a subset, right? So it involves predictions, decisions based on data. So without data, right, ML pretty much, right, you can't do, right? You can look at it as a sophisticated form of statistical analysis, right? Just like regression, right? You've got all these different distributions, right? You look at patterns, right? So what you can get from data, learns from data that have to be programmed, right? So let me put it in a more formal fashion, right? So the broadly, right, this is the overall thing is the artificial intelligence, right? It's a technique which enables machines to mimic human behavior, right, as much as possible. Machine learning becomes a subset of it, right? That pretty much relies on statistics, right, to improve the user experience. Deep learning again is a subset of machine learning, right? That makes what is called neural networks feasible. So how are these useful in a surgical scenario, right? So we'll look at them in the upcoming slides, right? So you have NLP, vision, text to speech, in robotics, motion, right? Supervised and unsupervised machine learning, right? How are they changing the landscape? Let's look at in the upcoming slides, right? Before I move into surgical robotics, let's talk about robots first. So when I say robots, right, this is the image that comes to your mind, right? Yes or no? Can somebody answer this question? When you hear the word robot, this is what comes to your mind, yes or no?
Yes, sir.
Right. But why is it so? Can somebody throw some light? Why is that you think of this, what is called a humanoid robot? Whenever we talk about robotics, this is what comes to your head, right? Why is this has got a connect? Yes, please go ahead.
We have seen the first
think-
robo in this.
It's
We think it's
mostly
an alternative. It's an alternative for human activities, kind of to support human activities, kind of.
okay, more of assistance, right? What you're saying is assistance, right? It provides
Yes, sir.
some sort of assistance. Okay,
Yes, sir.
that's a good viewpoint. Yes. Any other views? Movies, right? What does Endiran, iRobot, your Terminator? What have they portrayed, right? As a common man, right? What is it I get to see? I look at the big picture. I look at movies, and this is what traditionally robots have been portrayed to us, right? But this is a very small subset of robotics. When you talk about robotics, especially industrial robotics, right? This hardly is like 5%, like less than 5% of thing is in humanoid form, right? You look at from Boston Dynamics, right? The famous humanoid robot Atlas, right? Does all the somersault, performs all these acrobatics, right? Very interesting to see, right? But most robots are task specific, right? The reason why you have two arms, two legs, right? Again, from an evolutionary standpoint, right? It puts your vision at a higher level, so you can look farther. And basically, we were a hunter-gatherer civilization, right? If you look at historically, right? Animals are quadruped, right? You have all four legs that support your body. But the moment we had an erect spine, right? We could actually see farther and explore, right? Farther and look at things from a higher elevation, right? That allowed human beings to actually slowly go up the what is called the biological ladder, right? Basically, hunter-gatherer civilization background from an evolutionary standpoint. So deriving from that, right? People started building these what are called the humanoid robot, right? Resembling anthropomorphic, we say, just copying, mimicking the natural structural design of a human being. But I will show you, right, in the later part of the lecture, right? This is not a optimal configuration for achieving different tasks, right? Before I do so, let me highlight another prediction, remarkable prediction, right? This is where, I mean, compared to other futurists, right? Arthur C. Clarke nails certain things, right? Very precisely, right? What does he say, right? In 1965, he makes the following prediction. What is the prediction he makes? He says that he is perfectly serious when he makes a suggestion that someday, right? He's not sure when, he's not giving a timeline, but he's saying the following. He says, we may have brain surgeons in Edinburgh, right? Which is in UK, operating on patients in New Zealand, right? Which is like halfway across the world. And just understand this, industrial robots itself, right? I'll show you the evolution. Industrial robot itself, they have not evolved to a level where this man can predict this, but for him to make this suggestion is like nothing short of extraordinary, right? So let's start with the motive, right? Today you just imagine, right? If I've got some sort of a health issue, what is the first thing I do? I go to a hospital. Okay, once I go to a hospital, they do a diagnosis. The doctor performs an assessment, and then let's say I need surgical intervention, that I have to undergo some sort of an operation. What does he do? He fixes an appointment, and then the doctor he'll ask me to come on this day, right? Get admitted, get treated, then do a recovery, right? Then come back home, right? This is the process. But imagine you send an astronaut to space, right? For instance, right now people are talking about sending humans all the way to Mars, right? It's like a 7-8 month journey, right? Even our closest celestial neighbor moon took several days to go, right? Even something which you can see with bare eyes is going to take several days to go. Imagine Mars is also visible to the naked eye. Now even Mars, our neighbor, right, celestial neighbor, it's going to take several months to go there, right? Now you put in substantial resources to train an astronaut, right? Somebody's going to be an astronaut when they turn right, let's say 30-35 years old, right? Which means so much training has been invested in them. If they were to fall sick, during the journey, right? Imagine going to Mars, like going out of the solar system. You're talking years of travel. That being the case, if there is a need for some surgical intervention, right? What to do? You can't send a doctor, or the doctor themselves have to be the astronaut, right? So you can have, it's simply not possible. So the thought that NASA had back in the day, right? It's called DARPA, right? So they came up with this idea where they said, okay, we can't send a trained surgeon, right, with the astronaut. If they need surgical intervention, what we will do, we will have a doctor, right? Any doctor on Earth should be able to operate on a patient anywhere on the planet, either terrestrial or extraterrestrial, right? So this is the basic premise, basic thought that NASA had back in the early 80s, right? So you can look at the moon missions which started in 1969, right? The Apollo 11, the Apollo 13, right? Different programs, right? This was in the 70s. And now what they are thinking is, okay, we have conquered the moon. Let's go for, further, right? Let's keep exploring further, which means the challenges are also, right, exponentially higher. One of the thing is to how do you keep a human alive, right? So they are figuring out various systems, including how to perform surgery if an astronaut were to fall sick, right? Have you guys seen a movie called Prometheus? I think it's part 1 or 2. I don't remember. It was like it's been close to a decade. Has anyone seen a movie called Prometheus? Okay, so just for the benefit of audience, I'll just recapitulate one small scene from the movie, right? One of the astronauts, right? I think they travel to some planet, right? It's again a fiction movie, science fiction movie. So there are astronauts traveling in a right? So they're traveling to some planet, right? And one of the astronauts falls sick, right? They need some surgery. So they have a system where it's a bed, right? It's a capsule. You just have to go lie, and the system automatically performs a diagnosis, right? And then it operates on it, right? So that is what we call an autonomous system, which means you have a system that can perform a diagnosis, that can do imaging, that can do X-ray, CT, MRI, anything, any number of imaging modalities, which can understand what is wrong with you and take a action, right? Which can infer and act on you, right? Basically to restore functionality, right? So this is a fully autonomous system, right? I'll talk about classification in the upcoming slides. What I'm talking here is not autonomy at all, right? This system is not autonomous. In other words, system has got no intelligence. What the system does is assistance, right? The thinking is done by the doctor. The actual procedure is done by the doctor. But the robot, what it does is it will simply performs what is called copy, right? Whatever the doctor is doing, it will simply follow the instruction and carry out those instructions, right? So this we call telemanipulation, right? I'll talk about in the upcoming slides. Okay. So before I move further, like we spoke a little bit about AI, we looked at what is called singularity, technological singularity, and how hardware plays a role, right, in running all these sophisticated AI, ML algorithms. And we looked at what is a robot, right? And we looked at teleoperation. Now let me talk about what is a healthcare robot, right? Based on a EU Commission study, right? So what they say is robotics for medicine and healthcare is considered a domain of systems to be able to perform coordinated mechatronics actions, right? So what they mean is, right, force, when they say movement exertions, what they mean is palpation, right? If you say you have a stomach ache, what will the doctor do? Right? He or she is simply going to press your stomach with their hands and feel, right? Is it soft? Is it hard? Right? So that is what we call force or movement exertion. On the basis of processing information acquired through sensor technology, right? What are the kind of sensor technology, right? How hard is the tissue? Are there any abnormality? Are there any abnormal growth? Right? These are the things. So which means different sensor technology, which means you might use as simple as a simple piezo based load cell, or you might use an X-ray or a MRI. It can be anything, right? With the aim to support the functioning of impaired individuals, right? Impaired individual is somebody who is a patient, right? Medical intervention, care and rehabilitation of patients, and also to support individuals in prevention programs, right? We do master health checkup today, right? That is also something they are talking about, right? So let me talk about automotive autonomy, right? For instance, right, today Tesla claims, right, they have a completely autonomous car, right? Let's see if that is true, right? So this is autonomy, right? This I've taken it from Society of Automotive Engineers, SAEJ 3016 standard, and I've adapted this to surgical setting, right? So level 0 means there is no autonomy, like what I showed you. The telemanipulation will fall under this category, level 0 and 1, right? So level 1 is telemanipulation with support, right? It's a Da Vinci robot. I'll show a video in the upcoming slides. Level 2 is partially automated work, right? What this means is some primitive task, right? Like moving the camera, right? Or like moving a tool, right? So on and so forth. Level 3 automation is highly automated work, right? For instance, right? You've got a automated guided vehicle that takes medicine, that comes and gives you medicine at the scheduled time. That functions like a transporter, right? That sort of a thing. Level 4 autonomy is fully automated work, right? What this means is, right, there is a doctor, but the doctor, they themselves are not doing anything. It's a robot that operates on you, which cuts the tissue, opens the body, right, performs some suturing, that level. But there may be human intervention, right? Level 5 is what we talk about is called complete, fully autonomous system, right? You don't have to touch anything. And today these systems do not exist, even in lab, right? We don't have this, right? So from an automotive standpoint, we are at level 2, right? You have got what is called ADAS, automatic driver assistance systems. These systems can do something like adaptive cruise control. If you just press a button and then ask the car to stick to a particular gear and then follow the car in front of you. Today, most cars can do that, right? You can just buy it today. So this we call level 2. What right? Sophisticated cars like, for instance, Tesla Model S, what they can do is a little bit between level 2 and level 3, right? They can do what is called lane keep assist. If you move away from the lane, it will bring you back to the lane. If it identifies a pedestrian, it will brake, right? Without even asking you, it will brake. If you fall asleep, it will monitor you, right? And it will stop the car, bring it safely to rest. These are the things it can do, right? It's not highly automated, little bit of partially automated, right? Maybe we can call it level 2 or 2.5, right? We are here even in automotive space, and in medical space it's even more challenging. I'll show you why, right? So let's look at what is called surgical intervention, right? Before I do so, let me ask you another question. Has medicine really improved? Participants, I mean, it's a closed-ended question, right? You can say yes, you can say no, and then you can give a brief justification as to why you are saying that. Any answers? There are no right or wrong answers. You can just share your views.
Yes, sir,
Participants are
improved, sir.
improved. Why do you say that? Why do you say that?
Because we are able to identify new kind of this exponential that virus what we have explored recently, that
Okay, so you are referring to the pandemic, right?
COVID.
Yes.
Yeah.
Yes.
Yes.
So that's a good, I mean, that's a good point. Anyone
And
say, is there anyone who will say no? When you say no means that there is room for improvement. It has to improve. Right? Is there anybody who shares that sort of a view where you say no, medicine really needs to improve, right? I mean, I feel it has to improve. Does anyone share that view, an opposing view? No, right? Or is it so? Right? If you ask me, right? So I've been in this space for last about 10 years, right? If you ask me, my answer will be both. I will say yes and I will say no. Why do I say yes? Right? As one of the participants rightly pointed out, right? We are able to develop quickly, right? There was a global pandemic, right? So many people lost their lives. Quickly, we are able to develop vaccines in a very record time, right? In 3-4 months, right? The best minds got together, right? They devised, right? They isolated the virus, right? Figured out how to deal with it. In fact, different nations invented their own variations of these vaccines, right? That is not like one single vaccine. Russia had their own thing, US had their own thing, Moderna. Here we had Covaxin, Covishield, right? So many different variations, different labs. They attacked the problem using different methodologies, right? But everything worked, right? Most of all the efforts, right? they bore some fruit, right? So that way you can say, yes, medicine has improved, right? No doubt about it, right? The average life expectancy has gone up, right? Pain, right? From a pain standpoint, anesthesia, right? For instance, if you go to a dentist, right? He is going to drill your tooth, right? Fill up a cavity or extract a tooth, right? Very painful procedure, right? Because of the advent of modern medicine, right? The doctor, he or she is going to give you an injection in your mouth, right? Basically, you can carry out the procedure when you are fully aware, right? You have full consciousness when they even pull out a tooth, right? It's a very painful procedure. Imagine doing pulling your tooth out 200 years back. There is no anesthesia, right? You have to literally bear the pain, right? So in that way, medicine has really improved a lot. It has really alleviated human suffering, right? But I would also, in the same breath, I would argue medicine has got a long way to go. Why do I say that? Why do I also give you a mixed answer, right? Let's see why, right? Look at this. People who are not comfortable, please look away from the screen, right? Not a very pleasant picture, right? What is happening here? So this is during medieval period, right? This guy is a soldier. He's been shot in his foot, right? There's a bullet wound. What is happening? There is no anesthesia. So literally they are sawing his foot off. Why are they doing that? Right? Why are they doing that? Because if you are a medieval soldier in Europe and if you received a bullet wound, you will die not because of the wound, but because of the complications that arise from the wound, right? Once you have a wound, what is going to happen? There is going to be a bacterial infection, and then it will result in what is called sepsis, right? We say septic ido, right? We say you will get septic shock, right? And then the people will die because of the complications that arise out of having a wound, right? Which means the injured region, right? You don't have antibiotics, right? People did not understand germ theory. So what happens? So you have to chop off that arm for you to survive, right? Otherwise, the infection will spread throughout your body and it'll pretty much take out the person. So that is a very barbaric treatment, right? So there were two pivotal moments in medicine, right? The first one is the discovery of anesthesia, right? In 1846. Second thing is the introduction of antisepsis, right? A simple thing like Dettol, right? That you can apply, right? Or povidone, right? Povidone iodine solution, right? Pretty much, right? Kills all the bacteria and prevents the infection from spreading further, right? These are things we take for granted today, but we've come a long way, right? So this answers yes part of the question. Then why do I keep saying no, right? Let me quickly answer that. So again, this is an Indian context, right? So I'm slightly running a bit slow. Let me quickly speed up. So we have this thing called Sushruta Samhita. Okay, it's a encyclopedia, a compendium of all the instruments, right? This precedes, right? This is like we've had our Indian system where they've performed complicated surgeries like cataract surgery, right? You have scalpels, you have scissors, you have retractors, right? And we have our own Indian names for all this, right? Just quick this thing, right? It's not, what I'm trying to emphasize is, right? Surgical intervention did not only happen in the West, we also had, right, our own Indian researchers who have actually who have made substantial progress in this space. I'll talk about minimally invasive surgery before I jump to robotic assisted surgery and how AI and ML are, shaping up the field. So what is this MIS, right? In simple terms, we call this keyhole surgery, right? You make a small hole, you introduce a tool, right? And then you perform a surgery, right? This is how a traditional surgery is carried out, right? If a doctor has to operate on a patient, what the doctor does is they make a huge cut, huge incision. You can say the intestine, stomach, liver, everything. And then you operate on the patient and you suture it back, right? It works, right? People have been doing it for 100 years, right? Now, what is the problem with this technique? I end up with a huge hole in my belly. After suturing, the person might take several months to completely recuperate and get back to work, right? So it's highly invasive, right? Invasion. What is invasion? Somebody is going into a space where they are not welcome, right? So I'm going inside a human body. This is not natural, right? To cut open a human body is not natural. We are invading, right? Because that is the only way to save a patient, right? If somebody's got appendix, right? Appendix is somewhere here. If it is infected, appendectomy, you have to remove the appendix. So how do you do that? You have to make a big hole, right? Big incision, we call it. Incision is you cut open the body, right? This cut is called an incision. Now, if you have to extract, right, if you have to incise the infected appendix, which means I have to cut a hole. Otherwise, the patient, because of, again, you get sepsis that will spread all over the body and will kill the patient, right? So the only way to save the patient is to remove the appendix. How do you do that? This is how they were doing it. There was a German doctor in the 80s, right? What he proposed is that instead of making a huge hole, you make multiple small holes like this, and then you triangulate, right? And then you operate on the body. This is a radical technique that the doctor proposed, but the community was not welcoming of this idea. This is a new idea, right? Initially, when somebody proposes a new idea, initially the acceptance will not be there, right? So, but the doctor persisted and then proved the idea. Now this is standard. Today it is standard. Laparoscopy, right? What we call laparoscopic. Somebody's got like spine surgery, neck surgery. It's used all over the place, right? Neurology, nephrology, you name it, right? Laparoscopy today is a very mature field, right? People really understand very well, right? So this is the setup, right? So you put the tools, you insufflate, right? You pressurize the abdomen so you get some space to work and you perform the surgery. Because you are making multiple small holes, the patient can recover much faster, right? So in a day or two, patient can get back to work. So that's the advantage of this, right? So let me start with now robotics comes into picture. Why are they bringing in robotics? Reason is humans, we don't have steady hands. If I ask you just, right, all the audience, just I'll ask you to do a very basic exercise, right? Stretch your right hand out, right? Please follow my instruction, right? Just take your pen, right? And then hold your pen against a stationary reference, right? Edge of a table or, a point somewhere, doesn't matter. Try holding it, completely stretch out your arm and then see if you're able to maintain that pose, right? Is everybody doing it? I hope the participants are following, right? So what I'm saying is take your pen, right? Or a stick, anything. You just point at a corner, a edge of a table, fully stretched, right? Try doing that. If you see, you will have what is called minor hand tremor, right? It's impossible to maintain a very rigid pose, right? Because our body is not designed to like do these very precise tasks over a period of time, right? So imagine now, if this is the case, right? Now your hands are well rested. Imagine a surgery where a doctor has to sit and operate on a patient for 10 hours, right? It's not humanly possible to maintain a very steady hand, right? Steady hand. A doctor has to have, my master used to tell me, a doctor has to have eye of an eagle, right? A doctor has to have eye of an eagle and touch, right? Touch has to be so precise, right? So when you're talking about brain surgery, right? If you, for instance, somebody who's got brain tumor and you're removing it, if you remove any excess tissue, right, any healthy tissue, you might actually cause some sort of a impairment to the patient. They might lose their vision, they might lose their ability to walk, right? There are so many other complications that the doctor can unknowingly have. So in a neurosurgery, right, you have to be very precise, right? So what the doctors and the engineers back in the day they did is Puma 100, right? Puma 200, right? This is an industrial robot, right? So what does this do? This is a pick and place robot, right? Puma 200 is a very common robot, right? One of the very first robots that was built. They took a standard industrial arm and then performed what is called brain biopsy. What is a biopsy? If somebody is suspected of having a tumor, one gold standard to assess if it is a tumor is to take a small portion of the tissue and do a laboratory testing. You have to literally drill into your head, right? And then pick a small sample of the suspected tumor, right? And then take it and perform a test, lab test. If I have to do it by hand, yes, I can do it by hand. I need a very steady hand, right? Because I'm drilling into the bone, skull, then I'm puncturing through the meninges, right? I have to go, if it's deep-seated tumor, it's even more difficult, right? I have to go really deep, pull the tissue and come back, right? The very first time a robot was used in the context of medicine, right, in healthcare is to basically, you can see there is a line here. A robot can have very steady hands, right? It can go through a trajectory far better than any human can possibly do. Drill, take out a sample and come back, right? In 1985, they performed this experiment, right? And this was done in a CAT scanner, right? It's complete fluoroscopy is happening. Similarly, right? So there is a similar procedure they carry out in the same year. Now, for the first time, right, I showed an image of Honda Asimo, right, which is a humanoid robot. Now you see, this is a robot. If had I showed you this and said this is a robot, right, this is not something you would perceive as a robot, yes or no, right? So you can see a couple of motors are there. There's a ring gear here, right? Couple of other mechanisms. So what does this do? This performs what is called biopsy for prostate, right? So this is in 1988. So this is a dedicated robot. This is the robot that's built for a particular application. Then robots slowly find application in orthopedics, right? It's called RoboDoc in 1992, hip replacement, right? Total hip replacement. If you have to remove the hip, the worn out hip and put an artificial hip, this robot helps you do that. How does it help you do that? See, orthopedics is all about carpentry. Why do I say it's carpentry? You have to cut the bone as though you're chopping off a piece of wood, right? Very precisely, because if you change the angle, the natural kinematics of a person, right? The walking gait, everything will be affected. So you have to be very precise. You cannot take excess of the bone, and if you cut off the plane of cut, if it is even off by 1 degree, right, you will ruin the posture of the person, and that will result in complications. So robotics today is used standard, right? Anytime anybody goes to get a knee replacement, a hip replacement, there will be some sort of robotic assistance for sure, 100%, right? Then we looked at like efforts from NASA, right? Similarly, Stanford's Robotic Institute, right? It's called SRI. They work on a system similar to the teleoperation that I spoke of in the earlier part of the lecture. And NASA's Jet Propulsion Laboratory in 93, they build a system for eye surgery, right? These are all efforts that are taken to provide remote assistance, right? Today you have telemedicine, right? In COVID, what happened? You sat at your home, called the doctor, right? People quickly developed apps, right? Then teleconferencing, right? Telemedicine, right? You got some diagnosis. This is called a voice controlled robot, right? This will basically move the camera, right? Because the doctor only has 2 arms. If he has to hold the camera, simply not possible, right? So you usually have a assistant for a doctor who will hold the camera and they'll move the camera, right, left, right, up, down, right? Because you're doing laparoscopy, because you're going through holes, you can't do visualization of the operating field inside the body, right? So you need a camera, laparoscope. So this automated that task. And then there was this company called Zeus, right? They had a properly commercial robot. This company is no longer there. And then you have what is called the modern Da Vinci surgical system, right? Anywhere you see today, right? Robotic surgery, right? In Mayot, in Chettinad, in any hospital in Chennai, if you just Chennai or Bangalore, any hospital, see, this is the robot they are talking about mostly. Of course, there are these orthopedic systems that are there. Prevalently, if you see, right, this is a system that people talk about. Now, what is the key thing, right, to laparoscopic surgery, to minimally invasive surgery, is to enable it, give it the same features as a human hand, right? So this is more of on the mechanical side, right? So this is our setup is typically you have a doctor who sits in what is called the surgeon's console, right? So he's looking into a display, right? A CRT display, right? There are two, right? So he gets a stereoscopic vision, and there is a fiber optic connection to a controller, and the controller talks to the slave cart, right? It's called the slave arm. So whatever the doctor moves here, right, his hand movements are replicated by the robot. So theoretically, this slave can be anywhere in the world, right? They have done all the surgery 20 years back, right? 25 years back. One is between New York and France, right? It's called the transatlantic surgery, right? So surgeons sat in New York, they operated on a patient in France, right? People have done this in 2001 using the same principle, right? That we see here. Let me quickly play a video just to show you how good the precision of a Da Vinci robot is. Some of you may have seen. Just we all know how big a grape is, right? So the surgeon is going to just cut open the skin of a grape. So for perspective, all of us know the size of a grape. You can see how small these instruments are, right? lack of time, let me quickly run through the video. This video is freely available on YouTube, right? If you put DaVinci Robot, you'll get this video, right? So you can see how the doctor, you can see his hand movements, how the robot is replicating his hand movements, right? So you can see this is teleoperation in action, right? You're seeing the doctor is performing and the slave arm is literally copying his movements, hand movements, right? So now let's ask the question, why bother with this, right? Some of it I partially answered in the previous slides. One is smaller scars, right? You don't have to put any big scars, because of which your hospitalization is going to be shorter and side effects are going to be fewer, right? It's going to that's going to be reduced, and which means patient will recover faster, less pain, right? Less blood loss, right? So on and so forth, right? So these are the biggest advantages of involving robotics for surgery, right? So let me quickly run through a few other systems, right? This is the DaVinci system, right? So you can see it's making a knot here. This is the something like a Robotics system. It's drilling a bone for an implant, right? And this is again an orthopedic system. So here, after performing a CT, they do what is called a registration. They create a preoperative planning, and then you have a robot that basically performs all these cuts. The joint is stabilized, right? Before you do joint replacement, right? They bore out a cavity. You see the actual implant that's going in, right? So this we already saw, right? This is a palpation robot, right? This is feeling for any abnormality, right? This is just how, so this is level 1, level 2 autonomy, right? It's able to cut, right? Under guidance, and then slowly it peels off, right? Little bit of, they're trying to open, right? How a robot just to remove a tumor, right? This is where we are today, right? And it is closing the hole by gluing it. So again, what we see is a few procedures that are carried out autonomously, right? Like for instance, hair transplant, right? So which hair follicle to pull out, right? So you use these, right? So you can see you can put a virtual boundary and ask the system, right, not to move out of it. And this is cyber knife for cancer treatment, right? It is a knife. It says technically it's not a knife. It's just a beam, right? Electromagnetic beam that delivers radiation to the target, right? Because if I expose the entire patient to radiation, right, we will also kill the patient. So we want to kill only the cancer cell. So this precisely focuses the beam to the point where you need to kill the cancer cells. So that's why it's called a cyber knife, right? So it delivers targeted, right? So you can see, right? So if this is a tumor, right, slowly, especially what are called inoperable tumor, right? Certain tumors, it's so deep seated, right? If you try to reach them, right, you will actually cause more damage, right? You might even paralyze the patient. So these kind of things, this system is quite helpful. And again, we have these systems where, right, again, this system shows a spine surgery, right? How do you drill out and fuse the spine for people who have spondylitis, right, and other cases, right? So lack of time, I'll keep moving. So, right, how is AI revolutioning surgery? So it improves dexterity. What is dexterity? Try holding a pen and lock your wrist, right? The degrees of your freedom of your wrist you should not use. Try writing, right? It's very difficult, right? If you just try it, right? You just try it now or maybe after the talk, right? Without moving your hand, without enabling the wrist movement. Once you lock the wrist, once you write, right? It is almost impossible to write. So which means you are purposely cutting down on your dexterity, right? You're reducing your dexterity. What does dexterity mean? It is the ability to reach any pose, right? Any position, right? With your arm, right? Now these mechanical instruments that we have, they have difficulty reproducing the natural movement that a human arm has, right? So robotics helps you do that, and AI takes it one step further, right? AI today is used tremendously, right? In visualization, right? In tremor reduction, I spoke about now how you'll have shaky arms, right? When you're doing teleoperation, right? Your input itself, right? One is called intended motion, another one is called unintended motion. What is unintended? If you have shaky hands, that is not a valid input. The robot does not know what to recreate, right? If you have shaky hands, if you simply ask the robot to reproduce all my hand movements, even my handshake will also be replicated, right? That is unintended, right? If I'm making a precise cut, I'll have a shaky cut. So I can put an AI algorithm and then ask the system to differentiate, to do a classification of what is intended, what is unintended, right? Then do what is called tremor reduction. So the system is intelligent. It knows what is a valid input, what is an invalid input. Suddenly, if I give a jerky motion by mistake, right, it should not replicate that, right? So those are some of the areas where you have AI that plays a very active role. Automating tasks like suturing, tissue dissection, I just showed the video, right? How do you perform a straight cut? How do you perform a slightly complicated cut, right? So here I've got a tabulation that shows that, right? How do you enhance precision, right? How do you do tissue recognition? What is tissue recognition? So for instance, right, if I'm doing removal of tumor, how do I differentiate tumor and healthy tissue, right? If I remove excess brain, right, I am going to basically impact the outcome of the surgery. So AI will help me, right, to basically tell me, right, don't exceed this limit, right, because you don't want to remove any healthy tissue. Automated suturing and not, right, that's something we've been talking. Personalized surgical planning. What is surgical planning? So AI can do a assessment, right? It can analyze patient data to customize the surgical procedure to a particular patient. What it means is, right, demographics, right? Somebody will be very fat, somebody may be very thin, somebody whose organ placements may be slightly different, right? All these minor changes, AI can help the doctor in adjusting, in customizing the surgical thing, right? Autonomy, let's talk about autonomy, right? Now, this is the crux of today's talk, right? AI, ML, how do you bring about autonomy, right? So there are multiple spaces, right, in surgical space, right? Your gastroenterology, neurology, cardiology, orthopedics, and urology, right? In all these space, right? So if you look at it, in orthopedics, right, in bone resection, in milling out a cavity, right, it's done autonomously. To pretty much you can rely to some level. In urology, autonomous is not so much. Autonomy is not so much. In cardiology also, in neurology today, what we can do is we can put what is called a virtual boundary, right? So you can, before the procedure, the doctor can actually look at a MRI scan and then basically do a segmentation, right? Do an image segmentation in 3D and then limit the movement of a tool, put a virtual wall. Even if the doctor wants to remove the tissue, the system will not allow the doctor to move. So somewhere in level 2 autonomy, right? Just a few examples, right? Where is the future heading, right? I just showed you what is happening today, right? Where is this future heading, right? So if you look at non-laparoscopic robots, right? Eye surgery. I told you, right? Tremor is a big problem in a surgical setting, especially when we talk about something like corneal transplant, right? Somebody needs a corneal transplant from a donor. You have to do suturing, right? So cornea is something like butter. Imagine suturing butter. Can you stitch butter? Right? It's almost impossible, right? So that's what a doctor has to do if they have to do corneal transplant, right? So you need very steady hands, right? So you have these robots that are teleoperated for eye surgery, right? Electrode implant, right? So you have today Neuralink, right? The company from Elon Musk, right? They put deep brain stimulation. They put electrodes, and then, for instance, if somebody's got tremor, you can put electrodes and basically control the tremor, right? So at a very basic level, you have what is called bronchoscopy. Somebody is suspected of some lesion or some abnormality deep in their lungs. You can put something like a snake robot, what is called a continuum robot, right, through the nose, right, go through the vocal cord, larynx, right, then reach like a very unreachable space. And then you have cardiology, right? You have soft robots. That's like a sleeve. What you see is a sleeve that basically provides for people with weak heart, right? Again, it is in research, right? So not something that is used in clinical practice, right? So let me make that very clear. These are all in research. So you have a sleeve that basically helps somebody with a weak heart to pump, make it more efficient, right? And you have assistive wearable prosthetic robots, like prosthetic arm. Somebody who's lost an arm, how do you provide a suitable replacement, right? And then you have in imaging, diagnosis, right? What is called gastroscopy, right? You may be familiar with endoscopy, where they put a long tube, right? Fiber optic camera, right? To visualize, your stomach and small intestine, right? It's a very painful procedure. So today you have these things called what is called as a pill cam, right? Like a pill, you can swallow the cam and basically it does like a tablet, right? It's got the camera, battery, transmitter, everything as part of it, right? So that does the imaging for you, right? So on and so forth, right? So in soft robots, another happening area. What is soft robot? Typically, traditionally, robots are hard, right? They are rigid. Soft robots are more like millipedes, snakes, centipedes, snails, right? So more of a bio-inspired implementation, right? And then you go to the nanoscale, right? Nanomedicine, where in biotechnology we have we use sometimes what is called targeted drug delivery. You coat, right, a carrier that takes the medicine to a targeted to a specific target, right? So this summarizes the level of autonomy, right, in medical space formally, right? So we have all these procedures that I spoke of in the earlier slide. And then you can read this paper if you want to, right? You can refer to this paper. You may please note down if you want more information. So level 0 is no autonomy. Level 1 is, right, what I'm talking about, right? Teleoperation. Level 2 is task autonomy. What is task autonomy? Right? Do a very specific thing like cut a bone, right? Perform a suture, so on and so forth. Level 3 is conditional autonomy, right? Systems can generate task strategies, but relies on the user to select and approve a strategy, right? It'll give you two options, right? What to do, right? A doctor has to be in the loop to decide. Level 4 is highly autonomous, right? Robot can make decisions, but needs to be under the supervision. The doctor does not have to get involved, but there is a chance the system may make mistakes, right? So that is level 4. Level 5, as I said earlier, is a replacement for a human being, right? For a trained doctor, right? AI for surgery, right? This slide summarizes, right? One is called pre-operative planning. What is pre-operative planning? Before the operation, pre-operation, we are doing planning, right? What are we doing? For example, a practical example is uh, exactly where to cut a bone for an implant, right? Intraoperative guidance during an operation, right? Operation is going on, right? So task might include tissue tracking, right? What I've been talking about, right? How do you differentiate healthy cells from cells that are affected? Augmented reality, right? Depth perception becomes a problem in laparoscopy, right? Because I'm using thin instruments. I don't know how deep I am into the organ. So if you imagine something like your Vision Pro, Apple Vision Pro, or your Oculus, right? Meta, you have all these. Today you've got multiple virtual reality goggles, right? You can wear that and then get 3D visualization in real time. This is intraoperative guidance. And then, of course, I've been talking a lot about surgical robotics, right? So especially in orthopedic space, in cardiology space, right? A lot can be done, right? So future, what role is AI playing, right? Patient outcome prediction, right? Use of patient-centric data can forecast surgical readiness, outcomes, and recovery. For instance, right? Somebody who's got a tumor and this patient is 80 years old. Should I even bother doing a surgery on this patient? Because the moment I open the head, I'm going to cause more damage, right? So I can look at heuristics, right? Many such history, his family history, his genetics, his genetic profile, right? And demographics, whether he's an Indian, whether he's an American, right? What are the probability, right? AI again can play a huge role. Imaging, right? Identify fractures, orthopedic conditions. This is just sample, right? So the slide summarizes, gives you samples, right? Then navigation, right? I showed you the bronchoscope, right? How do you guide, right? Something to a target. Smart implants, right? Feed big data to predict outcomes and assist in device iteration. What this means is, right? Any implant, right? Unfortunately, today, you have all these hospitals claiming once you get an implant for life, it will stay there. That's not true, right? Implant might last for 10 years, 15 years, right? But eventually an implant will wear down, especially if it's a knee or a hip, right? These are all highly stressed. These are high wear, right, joints, which means eventually there will be a time, right? Unless somebody is getting an implant at 60 years old, right? They might expect to see, let's say, lived up to 75, 80 years, right? They might get away. Somebody who gets an implant, let's say they are 25, 30, right? They have to live with that implant for the next 40 years. That's definitely not going to last. Why? Right? Because if you go to the gym, work out a lot, you're going to put a lot more wear on the joint. Or if you are a little bit overweight, you're going to cause a lot more joint, right? Your posture, how do you sit, the kind of activity that you do. Somebody who works out in the field, somebody who's a civil engineer, right? Their job involves a lot of walking, right? So how do you customize an implant for people who are in different context and people who do different jobs, right? So there AI plays a very crucial role. How does it do that? It looks at the loading pattern, the lifestyle activity, right? The age factor, genetics, right? You can bring in so many, a multitude of parameters, right? Take all this into account, right? And make subtle changes, right? The material, choice of the material for the implant. Every implant is custom designed, right? Today, if you go, right, they will actually customize the implant to some degree, right? To you, because your body weight, your BMI, right? The kind of activity you do, right? How long is the implant expected to be inside you, right? All these factors come into play, right? Another big thing, right? AI is working on is, all of you know this, right? You have all these smartwatches, right? Predict rate of recovery based on patient motion. For instance, you have your Apple Watch, right? That tells you how many, what is your SpO2, right? The dissolved oxygen in your blood, the pulse rate, how stressed you are, your REM sleep, right? So many different things. So wearables are the next big thing. That's why you see Samsung, Apple fighting in this space. No discussion on AML in surgical space is complete without talking about medical imaging, right? This is the biggest application today. Let's see a little bit. Imaging started with Röntgen, right? He discovered X-rays, and from X-rays, right? It was used in World War, right? Parallel, you have computer development, right? One thing is radiology development, which is in the imaging modality. Second thing is computers are also evolving. So first AI program that played chess was in 1954, right? So AI is not new, right? It's been there for like 70 years now, right? And then you have rise of miniaturization. These two basically meet, and then you have what is called computerized radiology. You develop systems like CT scanner, computer tomography, right? Where you take slices, which is basically X-ray, but you take multiple X-rays, and then you can do a reconstruction. You can make a 3D reconstruction of a bone. So CT is basically for hard tissue like bones. MRI is for soft tissue like brain, your kidney, liver, any soft tissue, right? This can model hard tissue, this can model soft tissue. You combine both, you get a fantastic imaging modality, right? And then slowly, right, increasing utilization cost, volume burden to radiologists. What is volume burden? For instance, I have all these technology to generate, right, images, right? Give me a peek into the human body, right? First time you can peer into the human body without cutting open a patient, right? That's what these are called non-invasive, right? I am not invading, right? Non-invasive technologies, right? Non-invasive imaging modalities. So 1992 researchers, they use what is called mammography, right? Somebody who's got breast cancer, right? What is the stage of the cancer? How big is the cancer? The exact localization. Where is the cancer inside the in the patient, right? So on and so forth, right? So in 2017, FDA is Food and Drug Administration, which is a regulatory body in USA. They approve an AI-based algorithm, right? So pretty much, right? Today, a radiologist is a highly paid job. It needs decades of experience. Today, you have algorithms that are replacing them, right? So what are the benefits of using AI in radiology, right? Accurate classification. What is classifications? Can I just look at an X-ray and then say, okay, this guy has got a cyst, or he's got an abnormality of this, and this is the medical condition? That takes years of practice, right? Enhanced analysis, automated segmentation enhances image analysis and aids practicing radiologists, right? I am just starting out. I've just graduated, but I don't have enough experience to assess what is the condition. So I can have an algorithm that can do the classification for me, or if I make a mistake, it can help me out, right? That is what we talk about aiding, right? Generating 3D models from segmented images, right? This is how typically your CT scan works. And of course, this is faster. What are the challenges, right? Lack of standardization, right? What do I mean by standardization? Standardization means you do something in a systematic fashion. There is a flow chart you can follow, right? So different algorithms follow different strategies and the outcomes will be different, right? Sometimes, right, how these neural networks work, right? Nobody can clearly explain. It'll give you a solution, how it got to a solution, right? That's problematic. Lack of validation data set, right? And breach of privacy. Why? My data, right, is going to be sitting in the cloud like that. There are thousands, millions and millions of patient data which can be specifically traced back to me, right? So that's a cause for concern, right? And quickly, right, whatever I'm been talking about, right? So neurological abnormality, right? Classification of brain tumor. What is the type of tumor? How big is it, right? So you have, so this basically gives you a segmentation, this algorithm. This is a standard software, right? So I've taken screenshots and then I'm showing that here, right? And radiation dosage optimization. So we spoke about cyber knife, right? How much you have, right? What is called the standard dose, right? If you go to a doctor, the doctor is going to say, okay, this many moles per kilogram of tissue, right? So this is the assessment the radiologist might come up with. But at 10% dose, what will happen, right? So here you have a AI algorithm that says, okay, it can be, right, a fraction of what a human being proposes, right, for this, what is proposed, right? So in dosaging, right, in metering, what is called metering, uh, because why? The more radiation you give, the more healthy cells you are going to kill, right? So that is not good, right? So you have AI algorithms that basically help the doctors out. Similarly, in breast cancer, in classification of different conditions, right? Look at this. This is why radiology is so different. If I just showed you this, you just see multiple X-rays and you have algorithms that nicely segment out different problems, right? So these are from different patients. For you and me, they'll all look the same, right? So I don't even know there's an abnormality here, but the algorithm, you can see a heat map here, right? There is a mass here, there's a collection of some sort, right? There is an effusion here. So the algorithm tells you that, right? And multiple sclerosis, right? Sclerosis is when your own body immune system starts attacking, right? So it's able to actually identify regions, right, that are getting affected, and then suitable measure to address it, right? So let me talk about AI safety, right? AI is a tool like anything else, right? It's a modern tool, and every tool can be hacked, right? It has its own biases, it has its own problems, right? What are the typical problems? Let's see. One is called adversarial attacks. What is adversarial attacks? Somebody can write a Trojan horse, right? Something that infects the system, gives wrong diagnosis, right? If let's say an enemy country wants to attack a country, all they have to do is just send a program and it'll get downloaded to all their imaging systems and it'll give wrong data. That's it, right? You're going to treat your patients wrongly, right? So how do you protect this cyber security, right? How do you protect? So how do you have AIs that monitor AI, right? So this doesn't happen. Deep fake, right? All of you are very familiar with deep fake. Fairness. What is fairness? How do you get an unbiased view, unbiased assessment? For instance, today you have AI algorithms used in court, right? That go through court cases, right? To reach a verdict, to reach a conclusion, right? To reach a judgment. But it may be subject to its own biases, right? There was a case study in US, right, where more blacks were prosecuted, right? When they used an AI algorithm, even people who are innocent blacks were prosecuted because historically, right, you are using right, machine learning, you need data. Unfortunately, the data, right, more blacks were convicted in the past. The system was using that, and then it was convicting, so it was biased. If it sees a black person, it will say, okay, likely offender, and then it was reaching a verdict, right, against them without even taking other factors into account. Accountability. I'll talk about accountability in the next part of the presentation. Is AI responsible? If I spoke about radiation dosage here, right? Right. So this is what is a standard dose that people have arrived over like decades, and this is what the algorithm is saying. What if the dosage is not high enough and doesn't kill enough of the tissue, and then the tumor gets worse? Now the patient dies. Can you blame the algorithm or can you blame the doctor? Who has to take accountability, right? This is something people are still figuring out. Transparency, right? And ethical consideration, right? How much, again, these 3 points are very closely interconnected, right? Ethical consideration. Somebody dies, right? Who has to share the blame, right? So if somebody dies today, at least you can blame the doctor, right? The doctor messed up, the radiologist messed up, or there is some manufacturer, the machine, the medical device failed. So the manufacturer, you can sue the manufacturer. In this case, who takes responsibility, right? Let's take how vulnerable this AI is, for instance, right? So if this is from, I've taken this from this OpenAI, right? how this can superbly fail, right? How it can superbly fail. If I show you this picture and this picture for a human being, right, you will just say it's panda without even thinking, right? But AI doesn't do recognition in that, right? So there are certain features it is looking for, right? Oh, it's got two black things like this. Oh, it's the nose. So most likely it's a panda. With the confidence, right? It's not 100% sure it's a panda. But you can fool the algorithm, right? If you add this noise to this image, you end up with this, right? For a human, right? These two images appears exactly the same. But now, because of this, right, you can fool the algorithm into thinking this is a gibbon with 99% confidence, right? How AI can spectacularly fail, right? This is one example, right? Accountability, right? AI messes this up. This identifies this as a gibbon, where in practice it's a panda, right? So who is to take the blame? There's another classic case, right? Many of you may be knowing this, right? It's called a trolley problem. What is a trolley problem? There are two passengers going in a car, fully autonomous, right? TRL level 4 or higher. And there are two passengers, right? Sorry, two pedestrians that are taking the zebra crossing. For some reason, right? The algorithm, right? It has to come to a decision, right? Do I prevent, right? The car is going at a velocity where it cannot stop in time, right? So either it has to hit the pedestrians or it can swerve the car and hit the barrier. So if the car hits the barrier, the passengers are going to die, right? You have a mother and a son, right? And the mother is also pregnant. And the pedestrian, if you look at it, right, you have 8-year-old daughter and you have a father and a pet dog, right? There are three people here. Now, somebody has to die, right? Either it's the pedestrians or the passengers. What to do, right? So these are the kind of questions, right, people are trying to figure out. Nobody has got a clear answer, right? What is human life, right? So you say, okay, the lady is pregnant, let me let the algorithm let them hit, right, and save the passenger. Or okay, you got a child and a dad, right? There are ethical considerations, right? That's what I mean by ethical consideration, right? So what is the right thing to do, right? It's quite complicated, right? It's not straightforward. So other areas where AI and ML thrive, right? So in nanotechnology and biotechnology, right? Cancer research, I was talking about. Alzheimer, right? Alzheimer, right? Neural degeneracy. Slowly neurons die and people lose their memory. They start behaving weirdly, right? How do you build drugs, right? That interact with, right, the neurons and then improve the longevity, new drug discovery, new vaccine discovery, fusion power, working out complex mathematical patterns. Human Genome Project. What does Human Genome Project mean, right? Today, right, we have to do a huge multi-participant trial, right? Whenever they make a new drug, it's like a 10-year process, right? You want to make a new drug, new cancer drug, right? First, you have to make the drug, do what is called in silico, right? You do the testing in the computer. Then you take that and then you do a animal study, animal trials, right? You give it to a pig, you give it to a dog, monkey, right? You do a study there. Once you are sure of that it doesn't kill the animal over a period of time, then you do limited human trial. Then you do a extended human trial, right? And then you do it for several years and then you study different humans. And then suddenly you find the drug interaction for certain demographics, certain uh, uh, people, right? It may have some adverse effects. Then you go back, change the molecule, right? It's a very expensive process, right? Which means there is a web of network, right? That you have to see, right? The cause and effect, right? So that's what the Human Genome Project is all about, right? Mapping every single genome and then without even doing any extensive clinical trial, right? So you can actually do drug testing. And there are these people like researchers like George Church who focuses on, he's a genetist, right? He's looking at what is called longevity study. How do I enhance, right? The lifetime of a human being, right? These are some of the questions he's asking. Whether it is ethically correct, I don't know, but this is happening. Quantum computers, right? We looked at the limitation of silicon, right? Can I have a replacement for silicon, right? That is something AI is helping us out. Biological computation, right? So we have finite neurons in our head, right? It is said we can store data that's like close to six volumes of encyclopedia, right? That's like saying something like 400, 500 books worth of information, right? Just to touch upon. So just to quickly wrap up my talk, Michio Kaku, right? He's again futurist, right? So he says the following, right? He says, right, robots can't see very well. They see lines, squares, circles. They don't understand it's a face, right? This is not true today. Robots do understand today it's a face. This is a prediction he makes like 10 years back, right? Has been proven wrong in recent times. Robots don't have common sense, human behavior. They don't understand water is wet, right? They don't understand you can only pull with a string, not push, right? This is true. This prediction he made is true, right? ChatGPT still struggles with this, right? Often you will find, right, when you give it a query, right, it gives you something totally unexpected. Repetitive jobs are at risk. 100% true, right? This is true. Workers who engage in intellectual capitalism will survive, right? So he says, right, England gets more revenue from music than they get from coal, right? What to do, right? Is AI coming for your job? Can somebody answer this question? Is your job at risk? My job is at risk, right? I am a teacher,
Yes, sir.
researcher. My job is at risk. Yes, it is coming for my job. Yes. Will AI replace my job?
Yes, sir.
So I would say yes. Are all jobs under threat?
No, sir.
Mostly yes. I would say mostly yes. I'll back it up with some data, right? Then what am I supposed to do? Any idea?
We should have some balance with AI technology and the traditional technologies, sir.
That is something not in your control. OpenAI, you see, China and US are racing. Okay. What are they doing? Everybody I talk to, everywhere I see, every research article I see, they want to automate everything. Everything is going for level 4, level 5 automation. You can't stop it. I can't stop it. Because why? We live in a capitalistic system. What does capitalism reward? Right? It's a demand, it's a consumption-based economy, right? People want more for less, yes or no? You want to buy the best phone for the least price, which means
Yes, sir.
the process
sir.
that is involved in creating that phone has to be optimal, which means I need fewer people building that phone. I need more automation, right? This is the current structure we have, financial model we have. In this, you and I, we have little control on the policy. Even government can't do much, right? So you really need to look at, economic theory to understand what I'm getting at. So what am I supposed to do? What I would argue is do what AI cannot do. But then I'm contradicting myself. I'm saying AI can do everything. I'm also saying AI, you go do things that AI cannot do. How is this possible, right? I'm contradicting myself. So let me quickly, right, 5 minutes, right? If you don't hear the audio, please let me know. I'm going to play a video, okay? I am going to show you an area still, at least next 10 years, okay? This is my understanding. I may be completely wrong. This is my understanding, right? Where AI still has trouble. Okay, let me play this video, right? If you don't hear the audio, let me know. I'll go back to YouTube and play it directly. Participants, can you hear the audio?
Sorry, sir. Audio is
No, professor. No,
Okay,
professor.
let me, I will directly go to YouTube and play it here. Do you hear the audio here?
No,
No,
sir.
Sorry?
No, professor, we can't hear.
Okay, what I will do, okay, first time I'm using this. I will just put a link to this video in the chat. Okay. For some reason, I'm not able to load the chat.
yes, sir. Chat is
disabled.
visible, sir.
Chat is disabled.
Professor, you can use Q&A section.
Q&A section. Okay, let me just quickly type it out. So you can put LOTA and then say NID. Right? Just put this in YouTube, you'll get this video. Right? So I will just play the video, okay? And I will summarize the video for you because if I don't explain the video, it may not make sense. Okay. So what they did is, right? Charles and Ray right? They are two designers, okay? Right? So they came to India back in the 70s, okay? So they did looked at right, Pana, right? Tamil we call it the Pana, right? It's called Lota, right? They looked at it and then they looked at the evolution, right? How did this come about, right? So you look at this pot, right, lota, and then you see, right? You see the shape, right? And then you see what is it used for, right? It's used to carry water. You can keep rice inside this, right? How do you carry it, right? So you can carry it in different ways. How do you transport it, right? And let me quickly run through it. What is it made of? What are the different materials it is made of, right? What does it mean to possess it? What does it mean to sell it, right? So different aspect, right? How does it behave when you pour water into it? How does it affect the contents of it, right? How does it sound when you strike one lota with another, right? When two things, when they touch, right? What sort of noise does it produce, right? When you have a pot that's made of clay, it breaks, right? Instantly, right? For a human being, right? If a human being sees this, right? They know, okay, this is brittle. If I give it any impact, it will break, right? It will crumble, right? You understand? So what does it mean to, sell this? There is an emotional connect with it, right? Somebody who's selling it for, they'll have an emotional connect with it. Culturally, if I put curd inside this, right? How will this affect the contents, affect the taste, the feel, right? And look, different decorations. It's an ornamental piece sometimes, right? There is no functional. It's a thing of beauty, right? So, and historically, people have used it to make curd, butter, right? So on and so forth. So the point I'm trying to make here is the following, right? So please watch the video, right? You'll get a much more broader view. If I show this algorithm to an AI, sorry, if I show this video to an AI, what will it interpret, right? It will not interpret anything I told you. It will of course interpret, right? It will listen to you have a summary, YouTube summary, right? Today, you go to a YouTube video, it gives you a nice summary of what is being taught, right? But the way the human understands, right, is not the way an AI algorithm understands, right? Right? That's why I showed you Michio Kaku's thing. It does not understand water is wet. I see a picture of water, I know, oh, this is wet. If I put my hand, right, it's wet. It does not understand context, right? That's still AI is struggling with. They may fix it in another 5 years, 10 years. I don't know, right? I cannot predict the future, right? So what I'm telling you is, right? So there is this thing called World Economic Forum, WEF, right? They are a private body. They release what is called the job report, right? 2024, I think they have released it, right? So please check that, right? This is an older report. So they have what is called the future of job report, right? If you are somebody who looks for a job, please follow World Economic Forum job reports, right? So what are the top fastest growing jobs, right? They have put a list. AI and machine learning specialist, sustainable. Here, if you go through here, right? What are they saying? Robotic engineers, electrotechnology, right? Data analyst, agricultural equipment operator, right? They are saying operation, agricultural operation, because it is very hard to automate. Digital transformation. What are they saying is completely declining? You know this. Bank teller already gone, ATMs have gone, postal service, right? Data entry, administrative, executive secretary, accounting, bookkeeping, all are highly automatable tasks. Legislator, statistical financial clerks, door-to-door say sales workers. This I don't know, right? This is based on Europe and US they are giving, right? In India, of course, you have to take everything with a pinch of salt, right? Everything as a pinch of salt, not everything. This is also a prediction, please understand, done by a bunch of people. They also can get things wrong, right? So don't fear AI, right? Again, like anything, it is a tool, right? Now today it is like what to say, it is like used extensively, right? Even things that don't have AI, people claim to have AI, right? But as I showed, right, in medical space, it has got enormous potential, enormous benefit, right? It's helping out. In the end of the day, what is the point of all this technology? It is to limit and then minimize human suffering, right? So if somebody wants to reach out to me, you may please drop me a mail, right? I always have openings for internships, and then occasionally I do have openings for PhDs. Any questions, I'm happy to answer. Participants, any questions?
No, sir.
Participants, any questions, please? Professor, that was an excellent talk, Professor.
Thank you, madam. Thank you.
Any questions from participant side? Participants? I think no more questions from participant side, Professor. Thank you very much for accepting our invite and being part of this program, Professor. Thank you, Professor. Thanks a lot.
Thank you, madam.
Thank
Thank
you
you,
very much,
Doctor. Thank you, Dr. Satish, for the invitation. More than happy to oblige. And
Thank you, sir. Thank you.
yes, sir. Yes, sir. Thank you, sir. Thank you very much, sir. Thank you, madam. Thank you very much.
Thank you very much, sir.
Thank you, thank you, thank you,
Thank you,
Professor.
ma'am.
Thank you.
May I please sign off, madam?
Yes, Professor, please, Professor, please.
Okay, madam. Thank you. Thank you all.
Thank you. Participants, please stay in the meeting. Meanwhile, we will post the test link in the WhatsApp group. We request you all, once the test gets over, you please come to the meeting. We will have a valedictory function. We have posted the test link in the WhatsApp group. Please make a note of it. You please check and open the test link. To be able to open, anyone of you please confirm.
Yes, madam,
Yes,
it is
ma'am.
opening.
Yes, please
Yes, ma'am.
proceed. All the very best to all of you.
Thank you, ma'am.